Hi, my name is Pat Thompson. I'm public health nurse from Marshall County, and this is week 3 in a row, I believe, working with Craig on getting information out to you, our public, who we appreciate you watching the show and hope that you get some good information out of it. One thing this week I thought, my plan this week was actually to talk to you about what community nursing is, what public health nursing is, and so that there's a better understanding. And someday I will, when I have time to actually do some more research, so I have more better words to say. How's that sound? So anyway, but I want you to know that public health nursing, which is community nursing, is not the same as nursing such as a bedside that I had done for years, or at a clinic or anything like that. This is looking at the community as a whole. So when we're looking at how to keep the community safe, how to keep the community well, we're looking not just as individuals, but a community as a whole. So when we're looking at flu vaccines, you know, when we give that, it's seasonal, even though flu's year-round, like I always say. We educate and we promote, and we're trying to protect the public from the flu, and that's why we offer the flu vaccine. We do know that certain vaccines, in particular the flu, can be not as effective as, say, the the vaccine for hepatitis B. That one's way at the top of the 90s of effectiveness and protection. So, but the flu vaccine is the only way we can protect you, besides all those wonderful, boring things such as stay home if you're sick, wash your hands frequently, and cover your cough, like we've talked for years and years about. So anyway, I just want you to know that when we're looking at this, we're looking at community, we're looking at blood pressure control, how do we stay healthy, diabetes, any flu vaccines for children that we give. Those are all to keep the community safe. And when we have protection, then we don't get sick, and then we can't make anybody else sick, and that's just what it's all about. And so we're looking at this COVID-19, and it's, you know, it's a big deal. It has been a big deal, and it will continue to be a big deal. We're not done at all. We're not even, you know, they like Craig was talking, you know, we talk about flattening the curve and making sure that we don't get other people sick, and I'm jumping around here, I apologize. But anyway, flattening the curve doesn't mean that we can stop what we're doing, that we still need to stay home. Well, you know, one thing about being isolated, and, you know, we're all doing self-isolation, actually, whether you have COVID-19 or not, because we're staying homes to protect ourselves and protect other people. But also, isolation can be hard on us. I'm finding myself needing talking to some lady friends and getting together and just doing that chatting that you don't get to do even on the phone or through text and that type of stuff. And so we need to pay attention to ourselves and find out how it's affecting us. And if we find that we're having problems, each of us has some problems with feeling a little bit more depressed and less social and kind of withdrawn, that, you know, you need to, there are calls and there are means of getting some help with that through telemedicine type places and that type of thing. So I know that Craig has talked to me about NAMI, N-A-M-I, and I don't know what that exactly stands for right now because I didn't study it, but it's an organization that helps us with mental health. It's a national something or other, of mental institute or whatever it may be. But don't hesitate to call for help or ask questions, because maybe just sitting and chatting for a moment with someone who can say, yeah, I know, that actually is a true feeling that you have, and maybe give suggestions on how to get past some of these hard times, because they are hard times and they're lonely times. And if you live alone, that isolation is actually hard on us because we have less contact, and we kind of withdraw with that and stay in our homes, which we're supposed to do, but sometimes that's not always healthy too. So we don't have our friends to even talk to about how we're feeling. So don't hesitate to seek help. If you Google, there's always sites that come up. Always use credible sites. Always, because there's, and don't use Facebook. I'm going to say this, Facebook is not your friend. Okay, it's maybe a means of getting some information, but it may not be correct information, so make sure that you're using credible sites and being wise on what you are reading and understanding. So I know lots of people are doing more crafts, they're cooking more, they're finding outlets that they probably hadn't even considered exploring for a while, but it can be done, and that's where our imagination and our the fun side of us can come out. Stay home, please. Don't congregate. And that means even in the neighborhood, you know, you stand 6 feet away from each other. And actually, it's just best not to do it at all, because then it's hard not to give hugs and that type of thing. But don't congregate. Wear masks when you're out, and that means even in your yard. That's, you know, because, you know, I have lovely neighbors that we want to chat, or chat from the deck type of thing, but we really need to make sure that we're protecting them from us, because the mask actually doesn't protect us from them, it protects other people from you, is really what that mask is about. It's not an N95 or any kind of a full protection from viruses, so you still need to maintain your 6 foot social distancing. So with a mask on, you still continue the same thing, but you're trying to keep your germs and viruses inside here, not very efficiently, but still can help from other people. And that's how we take good care of each other. So we're seeing things that are, you know, we're seeing that it is effective. This social distancing, staying away from each other is helpful and working. It's more than helpful, it's working, and now we still need to continue it. You know, when we look at our summer plans and our spring plans, you know, this spring is way different. For one thing, snow, shoveling and mowing. Seems like that's what we're doing now, back and forth, and hopefully the snow will quit coming after a while. We know it will, but there's even been snow on May 1st in the past, so we just have to go with that. It's spring. But anyway, it's, you know, we just still need to look forward to better weather and being able to be in our yards and that type of thing, but we won't be able to do some of the things that we have done in the past. You know, it does affect weddings. It does affect graduations. It does affect our sports teams that people, you know, identify with. And I even think about, you know, even a 5K where it's an individual sport, but people congregate to prepare for that and before they even start the run, you know, that type of thing. And not that I run a 5K. Let me be clear on that. But some people do. I enjoy walking them, actually, and it's a good way to get exercise. So it's the same old. It's like preaching the choir here, is to, you know, stay home if you're sick. And I mean anything. If you're not feeling well at all, even the beginning, like headaches, if you have a headache, stay home in particular. Okay, headaches, muscle aches. This virus is kind of wicked, is what I tell people. And when I talk to people that are coming off of self-isolation, I say it's kind of a mean virus world out there. It's kind of wicked out there. So, you know, still protect yourself. Still do the social distancing, please. Do the 3 things that public health always asks you to do. So I wanted to tell you another thing is when I do investigations, so I'm asked by the Iowa Department of Public Health, each county, and I'm Marshall County Public Health, to do investigations because we're collecting data to see what kind of people may have more problems. You know, we're looking at collecting data, and we're also looking at educating to help protect the person that is ill, the person's family, and the public. So when I call and someone is confirmed positive, I give the direction to please go into a room by yourself, close the door, and people can bring you your meals, your liquids that you drink, water, milk, juice, whatever you drink, and you stay in that room for 7 days, at least 7 days, which I know sounds impossible. Only come out to go use the bathroom, that type of thing, and monitor your temperature twice a day, and just let yourself heal up. But the rest of the family needs to stay away from you because we're starting to count down the incubation period of how long it takes to get sick after being exposed to someone with COVID-19. And so that's 14 days. So the family needs to be isolated from the rest of the world. They can't go to work either. and not have people come into their house. So anybody's ill needs to be self-isolated, and then the family continues to do their family thing, but they can't leave the house. You know, they can go into the yard, but then we get kind of dicey, don't we? Stay in the house, please, because then I know that you'll know what to do with that. But anyway, so that's the direction of public health, to help stop the spread from the person that has it, okay, to make sure that their household members do not get sick. And then if they do, then they need to isolate themselves also. So it gets kind of complicated. It's kind of hard. And I know that self-isolating is very hard. I get questions such as, how do I pay my bills? And those are very fair questions, because we're asking them to not leave the home, to protect the community is what it's all about. So community health, population health, public health, that's what we're doing, is trying to take care of people. But, you know, I have to tell you, though, I'm very grateful and thankful and pleased at how well people do, how well they try to do what we ask them to do, and it's not easy. So we have to know that. And if anybody has any further illness, so they're not feeling like they're, you know, if they feel like their breathing's really poor or they can't breathe, then they need to call their own doctor. Public health is there to give direction and education, but you go to your healthcare provider for any health concerns that are dangerous or scary. We know, I have to tell you though, with this, there's no magic pill with COVID-19 to make you feel better, except for analgesics that you would use on your own for any kind of illness, what you would normally do. And there's no magic cure. It's just waiting it out and healing. And that's sometimes the hardest part too, because people just feel they can not be as affected as others, but they, you know, there's usually something that drives them to be tested, and that usually is not feeling well. And they usually feel pretty sick, the ones that I know about. We know that testing hasn't happened to everybody yet, and that's being worked toward. We're working toward that, and when that happens, it'll be I'll tell you more about it at the time. How's that sound? We'll see if that really does happen. And actually, that's right now. It's currently being tests are currently being done through healthcare providers, doctors' offices, urgent care clinics, the hospital for hospitalized patients that qualify. And so it's just kind of it's up to the healthcare provider to order those tests, you know, or excuse me, order that test for checking to see if you have COVID-19. I know you don't want it. I don't want it. That's why I stay home. I go grocery shopping once a week, and did a little bit more before Easter, just trying to gather some, you know, supplies that when you do a little mini Easter dinner with, you know, you always have to go to the store more than once when you prepare for family. I understand that. But so I had to do that even for a mini Easter dinner. How's that sound? And but try to avoid it because we just need to stay home. So we have flattening of the curve, as we can see that, which prolongs the response, but we can't have everybody sick at one time, or that will lead to more complications than you ever dream. So I encourage you to wear a mask whenever you're outside the home, even if you don't want to. And but actually, they're becoming quite fashionable. And if you know people that make you know, a cloth mask, you can express who you are through your mask. Maybe it's a sports team, or a pretty spring, or a child's mask. But wear a mask when you do go shopping or go out. It's one person from the home, the healthiest person there actually, needs to do the shopping, so that you're not congregating, because there's more people to be exposed in your family, and you do not want that. So send one person only. And it's not a family affair. It's not shopping. And I totally get shopping. Right now, I'm not a big shopper, but I wish I could right now. So so everybody needs it every once in a while. So so anyway, public health is still here, and I'm taking phone calls and trying to actually and doing investigations too, which is always And you know, I get to take care of people, and that's what's important to me. So you take care. Remember all that social distancing. How many times can I say it? Wash your hands, cover your cough, wear your mask, and don't trust that things are going to be okay soon, because they are not. But it will be. And also remember our kindness and our patience, and some sweetness in the world would be pretty special too. So take care of people that way also, and take care of yourself. Bye-bye till next time.